Now to the latest in the deadly hantavirus outbreak that turned an Atlantic cruise ship into a nightmare. Officials confirming an American has tested positive, and there's growing questions about the CDC's role in containing the outbreak. In recent interviews, the acting CDC director and a former CDC director giving conflicting messages.
But it is atypical to have so much quiet from CDC and really letting another organization be the voice that Americans are listening to.
This is not COVID, Jake, and we don't want to treat it like COVID. We don't want to cause a public panic over this. We want to treat it with the hantavirus protocols that we're successful in containing outbreaks in the past. They didn't see what the CDC has been doing, right? So we are in touch with the WHO. We're in touch with the international health organizations.
And joining me this morning is Dr. Dean Blumberg with UC Davis Health. Thank you so much for being with us this morning. A lot of questions right now, especially when we're talking about a virus outbreak. People think directly COVID-19 and the pandemic. So how is this different? Should people be concerned?
I think people should be aware of it, but the risk of transmission, the risk of an outbreak is basically zero, and the risk of transmission is very low unless you have prolonged intimate contact with somebody who's infectious.
So how is the transmission for hantavirus different from COVID-19?
So from COVID, remember, we were doing all that social distancing, keeping our distance from people. Just being within 3 feet of people for a brief period of time could result in transmission of COVID. With hantavirus, it's prolonged intimate contact. And so that's like a couple who's sleeping together or a nurse who's taking care of a patient for several days. So that's how more infectious COVID is compared to hantavirus.
So would this mean it is more difficult, maybe, from person-to-person contact to get hantavirus versus COVID-19?
Exactly. It's very easy to transmit COVID, much more difficult to transmit hantavirus.
So should people be worried right now about the risk level and also traveling? It's summer. A lot of people have cruises, a lot of air travel. Should people be concerned?
So the thing about the cruise ship is it's going to amplify any kind of infection. This was a unique case in that the people who had hantavirus, the only transmittable, human-to-human transmittable case of hantavirus, were on this cruise ship. So if you're traveling to other areas of the world where this hantavirus isn't located, there's no risk of transmission on a cruise ship. Travel to the Caribbean, Hawaii, Alaska, Europe, there's no transmission in those areas.
Perfect. So for now, people should not be that concerned. What would you say the risk level is right now?
It's extraordinarily low unless you have direct, prolonged, intimate contact with one of these cases that we already know about. And public health, the California Department of Public Health, and local public health in California know each of these exposed patients, and they are being monitored.
Is there maybe a risk of a pandemic? That's something that people might be wondering right now.
Not at all. With COVID, you had 2 to 4 people who were infected for every 1 case of COVID. And that's why you could have an explosive outbreak, a pandemic. With hantavirus, it's less than 1 per person. So any kind of transmission chain is going to die out very quickly.
Another question that we saw earlier last week was they were saying coronavirus was new. We were studying it as it was happening. This is something that we have more information about. Is that true?
Absolutely. So remember that COVID, there were a bunch of mutations that had occurred in previous strains of coronavirus, and that resulted in basically a new strain. With this hantavirus strain, it's already been sequenced by the World Health Organization. There are no dangerous new mutations. This is the same old hantavirus that was being infectious earlier in Argentina. So there's no strain changes that result in it being more infectious.
And as the weeks go by, what are the symptoms people should watch out for, and when is it time to seek medical attention?
Well, it starts off as fever, coughing, maybe some muscle aches, similar to other infections. But then there's very rapid onset of very severe pneumonia. And so this results in patients being extraordinarily short of breath. So anybody who's having trouble breathing, being short of breath, go to the emergency department right away because you're going to need help.
And one big question has been, we haven't heard a lot from the CDC and how this is being handled. From your perspective, should we be hearing a little bit more about this virus? There's lots of questions. Would that help, calm people down and not create panic?
It's always useful to have what we usually get from the CDC, which is these health alerts from the Health Alert Network. And that's been missing currently. And so we could use more involvement from the CDC. Usually they'd be on site helping helping with the investigation. And I think because there is short staffing at the CDC because of all the cuts and temporary leadership, there's been a lack in that area.
Yeah, but main message, not risk at all right now. People should not be concerned. Thank you so much, Doctor, for being with us this morning.